Republican Congressman John Shadegg is one of the critics, one of the strongest critics of the Democrats' proposal. He joins us now from the Capitol. Congressman Shadegg, welcome here. Congratulations. Congratulations on a great piece in the Wall Street Journal this morning, which really nailed it. Here's what I want to know. One of the things that Congress always does is to make sure that trade can be conducted from state to state. Interstate commerce is open and free. Why has the Congress not gotten rid of a Truman-era law that allows the states to prevent out-of-state insurance companies from selling health insurance in-state?
The answer is it's the view of the nanny state, and the current Congress is controlled by those who adhere to the nanny state, that we need to protect people. And if we allowed interstate commerce, thus bringing down prices and increasing competition, we wouldn't be able to protect people as much as the nanny state Congress wants to be able to protect them. So my colleagues in the United States Congress, when we were able to get interstate competition in health insurance through the Commerce Committee 3 years ago, defeated that idea or precluded it from coming up on the floor. They don't like competition, they don't like free market, and they think they know better what care you need and what you ought to pay for it.
Last month on the radio show that I share with my Fox colleague, Brian Kilmeade, we had on one of your colleagues, Congressman James Clyburn, the #3 ranking Democrat in the House. I want you to take a listen to a question I put to him and an answer he gave to me.
Where in the Constitution is the federal government charged with maintaining people's health?
Well, there's not in the Constitution. There's nothing in the Constitution that says the federal government has got anything to do with most of the stuff that we do.
There's nothing in the Constitution that says the federal government has anything to do with most of the stuff we have to do. I thank him for his candor. Is that the attitude that pervades in that building where you work?
I think it really kind of is the attitude. Most members of Congress don't read the Constitution, certainly don't think about it closely. What they're really concerned about is getting themselves reelected. You got to give Congressman Clyburn points for candor. He admitted point blank there's no constitutional basis for much of what they do, and at least he was honest about it. The reality is, because they don't adhere to the Constitution, the federal government is spending itself into oblivion. It's inserting itself in places it can't possibly be. I think the current deficit is up to 12% of GDP at all-time record highs. We are bankrupting the nation because there are no constraints on what we can do. And now we face the most massive takeover of health care in American history. It isn't patient choice focused. It won't control cost. It won't give you and I choice. It won't force the insurance companies to compete. And that's why costs are so high right now, because they don't have to compete. And it will cost, at least by their admission, $1.05 trillion. And you and I know those estimates are always low. America has to speak up and stop this bill. Interestingly, the votes for this bill are slipping backward. There's another rally here in Washington tomorrow at 1 o'clock. I hope Americans will go to their congressman's office tomorrow and protest, or come here to Washington and protest. We've got to stop this thing.
The Republican leadership has proposed a bill which does things like require insurance companies to keep people who are sick covered. A good thing. But doesn't that presume a federal role in health care? And you and I know there's nothing in the Constitution about the federal government having anything to do with health care?
It really does. And you can take a purist position. My friend Ron Paul takes a purist position on many of these issues and votes no on everything. I could wish we'd get back to the Constitution, and I've introduced a bill called the Enumerated Powers Act that would require us to recite the section of the Constitution that requires us to act. But in the absence of that, I think what the minority party feels is that they have to be in the ballgame. In America, we passed a law called EMTALA a number of years ago. It gives free coverage to everyone in this country, and you probably are aware, citizen or illegal, when they show up at an emergency room. The idea behind the Republican proposal here is that we should, for people with pre-existing conditions, create a high-risk pool and share within society the cost of those people who are just unfortunate enough to be stricken with a high-risk disease, a very expensive disease like MS or like diabetes. So you're right. The constitutional purist position is, in fact, would make our bill wrong. It's how do you stay in the game? How do you deal with America where America is today?
Congressman Shadegg,
people.
Good luck with that battle you're going to have tomorrow, and thanks for joining us.
It's a great fight. I hope people will speak out.
Thank you. An update on 2 horrific shootings, plus growing deficits and unemployment, plus a public that's sick of politics as usual. Is now the time for a third party? Congressman Ron Paul is next.